from the health department.
Hi, Shannon.
I have a question for you. Grant, maybe too. I think my understanding is that the Missoula Reopening Working Group is appointed both by the mayor and the county commissioners. Is that right?
If I heard your question correctly, Shannon, it was who was on that reopening working group?
No, who was it appointed by?
It was commissioners, economic partnership, and my office.
Okay, perfect. Thank you.
Yeah. And we took a lot of suggestions. Well, there's Shannon now in real life. Ladies and gentlemen, it is 12:31. We have about 38, 39 folks now participating virtually in this meeting. So we'll go ahead and get started with the press conference. A couple of housekeeping measures. If you're not talking, please mute yourselves, and that will improve audio quality considerably. And certainly if you're a speaker, we'd love to have you turn your video on. We are recording this, and the video will be posted to YouTube, and Missoula Community Access Television is also recording this and will provide a stream as well. This is a press conference today, and we don't have ability to do a town hall. So we can't take public comment today, but we will take reporters' questions after we provide some initial opening statements. However, if you are interested in weighing in any way, there are a number of ways to do that. And the most effective today is via email at ENV Health, that's environmental health, ENV Health at missoulacounty.us. And Shannon and her team will see all of what you all have to say as we march down a path. I am serving as your host today because the standard has plummeted, but I will be doing some introductions and offering a few remarks of my own as we talk about how Missoula County, City of Missoula, and all of our partners are engaging in reopening in light of COVID-19 and our response to the pandemic. We are going to start today with Grant Kier. Grant is the Executive Director of the Missoula Economic Partnership. Mr. Kier.
Thank you, Mayor, and thank you everybody in the press team for joining us today. I guess I want to start by just recognizing the tremendous sacrifice and work that everybody in our community has done to get us to the place that we are today. That includes the loss of life, the loss of jobs, the loss of businesses, and in fact, the loss of so many things that we all enjoy every day. And it is really a testament to the work that everybody has done and the sacrifices that have been made to follow the shelter-in-place ordinance, to follow guidance from our health department. That's put us in a position to be able to reopen. And I think unquestionably, we are among the first in the nation and world to be able to do this. And I have no doubt we can be a model for the whole world and our country. And I think it's really up to us to decide what kind of model we want to be. And part of today is talking about what we've done to be a model of this and what people can continue to do to be a model for this. So what I will say is that at the Economic Partnership, we have been really pleased to see that our elected officials and our business leaders have been incredible at giving a tremendous amount of information to our county health department to make good decisions and informed decisions. And I think really good about giving them the space to lead us through the science and the decision making that tell us where we need to be at the right time. A big part of that has been an incredible amount of cooperation and communication with the business community to really understand what we have heard and seen in terms of concerns from our business community, concerns from employees, and concerns from potential customers, and trying to offer the science and the data to support where we are, and the clear and concise guidance that gives our business community and our employee community and our visiting patrons the confidence that we're doing everything we can to create, develop, and implement the best practices to move forward. So I think today was a chance to just hear from all of the folks who have been a part of that and talk about the steps we're doing going forward. The last thing I would say is just that what we're looking for from our public right now is recognition of the hard work and the sacrifice that our business community has made to be able to get to this place, and the efforts that they are going through to be following the guidance that's come out of our community health department, and to ensure that that guidance is being implemented every day. And the way that the public can do that is to be respectful of those business owners, to follow the practices they're asking them to follow in their places of business, recognizing that they are doing everything they can to keep their business open, to meet the needs of their employees and customers, and to ensure that everybody who comes into that space feels as safe as they need to feel to be able to do business as they need. So that's really the goals today. And I think much work has been done with a community working group that has reflected everything from business owners and institutional leaders and health department staff and members of our faith-based organizations, to ensure that everybody has access to the kind of information they need to understand what guidance policies are in place. We at MEP have created a website that you can find at missoulapartnership.com that includes a very transparent way to access that information and understand what's being done and what kind of guidance is being presented. And we have a task force that is gathering feedback all the time from businesses about any additional questions or concerns, and fielding those to the health department to make sure that our businesses are getting the answers they need, and we can continue to refine our practices and do the best we can to create the safest possible environments for people to move forward. So with that, I want to turn this over to the next speakers and just thank our community elected officials and our health department and our business leaders who are here today for the amazing work they've done so far.
Thank you, Grant. We appreciate that very much. Next up is Commissioner Josh Slotnick from the Missoula County Board of Commissioners.
Great. Thank you so much, Mayor. Thanks a lot, Grant. And I want to thank all the folks from our press team who are here today. We're talking about a bit of an opening up. And when I'm thinking about what that means, I'm thinking about it as mitigating risk. And this is actually something that we're pretty comfortable doing. The analogy that comes to mind is that if you choose to go hurtle down the highway wrapped in metal and plastic at 80 miles an hour, that sounds like a pretty risky thing to do. But as a society working through government, we mitigated that risk through having traffic laws. And then as individuals, we exercise personal responsibility by obeying those traffic laws. Now, the situation we're in right now is really new and isn't quite akin to driving. I don't mean to make that comparison, but the responsibility piece and the mitigation of risk piece is really similar. So through government, through our health department, through the governor, we've created a set of protocols that businesses are following. And as an individual, if you follow those protocols that apply to you, we've mitigated risk so that we should be able to go out there into the world. And I'm really excited personally to do that after being a bit stir crazy. If anyone wants to go to lunch, reach out to me before I lose my mind. So what I want to encourage everybody to do, business owners who are following the rules and individuals, follow those rules, and then go forth, open up, let's celebrate who we are. And thankfully, our numbers here have been really low, and they've been really low because we've been doing just the kind of thing I'm saying. Our numbers are so low that for most people, like myself included, I don't know anybody who's had this disease, but we all know someone who's been dreadfully affected because of their business, their job, the businesses they engage with. Everybody knows somebody like that. And now's the time to mitigate risk, exercise personal responsibility, and go take part in our local economy. That's what I got.
Well, Thank you, Commissioner. And I'll just add that mitigation of risk is critical. We have a shared responsibility as residents of this place we love to take care of one another. And we've done a lot of that over the course of this pandemic. And as we enter this new phase, it's another opportunity for us to be respectful, conscientious, and care for one another. So that means following the protocols. The restaurants, bars, and retailers who are open, by and large, are taking this very seriously. They're following health guidance, they're following CDC guidance. They are paying attention to the health and welfare of not only themselves, their employees, but also their customers and the broader community. And I have faith in those businesses, and I have faith in the community that will engage in personal responsibility. It is not over. If you are paying any attention to headlines, we did not flip a switch and COVID-19 has gone away. We do believe that based on science, based on data, based on professional expertise, that we can enter the slow phase of reopening safely, and that folks have an opportunity to take part in more of the life that we know and love here in Missoula, Montana. And provided that we all cooperate and do it collectively, we believe that we'll keep our numbers low, or keep that case level at zero. But it's going to take all of us working together. And that's why we wanted to get together with you today to answer questions about that, to make sure that you understood that this is a slow roll, that the virus is still afoot, but we believe that we can work together cautiously to open things up enough that we can start to enjoy life a bit, and we can also get our economy rolling. There are a lot of people hurting, not only in the world, in the United States, but certainly in our community. We want to get people back to work safe and get money flowing again, so that folks can live productive, meaningful lives here in this place we love. At this point, I am happy to turn it over to Cindy Farr. She is our incident commander at the Missoula City County Health Department and has been leading the charge from day one, and she remains vertical, lo these many weeks later. So, Cindy.
Thanks, Mayor Egan. So a couple of things that I just want to point out. This is definitely the right time to start moving forward, and we just need to do so very responsibly. We're at a lot different place than where we were a week and a half ago. We haven't had any new cases in exactly 2 weeks, which is one full incubation period for COVID-19, and we've had 0 cases for almost a week. Our close contacts in quarantine are also now at 0, and our testing capacity and the number of people tested continues to improve. The stay-at-home directive and social distancing measures made a huge impact on how we were able to suppress this disease in our community. And while we work to get back to a new normal, we really need to appreciate that there still is risk. We're not at the end of this pandemic by any means. And we want the sacrifices and the work that we've all done to matter. And that's why it's so important that we all continue to work together. While things are opening, like I said, it does not mean that this disease is gone. Everyone just needs to continue to practice those really good social distancing, good hygiene, stay at home when you're sick, and remember that changes in behavior really make a big difference. So as far as the reopening process, the health department gets guidance from the state health department, Governor Bullock, and health organizations such as Johns Hopkins and CDC, and then environmental health uses that guidance to work with businesses and other organizations on ways that they might be able to minimize the risk of COVID-19 for their customers and for their employees. And this guidance is going to continue to evolve based on our case numbers and the risks that we're seeing locally, as well as the requirements from the state level under Governor Bullock's directives. So we're going to just continue to unfold here in our Missoula community and assess as we can. And what we really want to get out there is that this is the time for us to start moving forward and being able to open up our local economy. And we just want Missoula what people in the public can do to follow the procedures that businesses have put into place in order to protect you as their customer and also to protect your employees. So please respect those measures that have been put into place. And with that, I'm ready to turn it over to Shannon so that she can talk about kind of how we developed that guidance and how we go in this community.
Hi, well, thank you. Oh, sorry, Mayor Ingham.
Oh, you're just fine. I just wanted to give you a proper introduction, Shannon. So Shannon Terrio is the director of our City County Health Department. Pardon me, good grief, Environmental Health Division. Shannon and her team are on the front lines of providing guidance and help to restaurants and retailers and everyone in the community with regard to safe practices around reopening now and safe practices in general when we're in a normal state of affairs. So with that, Ms. Terrio.
Thank you. Thank you, Mayor Ingen. Yep. My name is Shannon Terrio, and as Environmental Health Director in the Environmental Health Division, our role really is to help businesses understand and implement both the governor's directive and the health officer's order as it pertains to reopening. We've done that in a number of ways. Initially, before the governor reopened and before we understood what the guidance would be, we did bring together some guidance from national and local agencies to look at what might help in bars and restaurants and to reduce the transmission of COVID-19 or the possibility of transmission of COVID-19 once reopening started. And then once the governor issued the reopening plan, really a lot of what we were talking about and a lot of the feedback that we got from some of our key stakeholders in the food and bar industry was contained in the governor's plan. So then after we got that, basically what we have been doing is we got out some information to those businesses, and then we have been answering a lot of calls. Really appreciate that bars and restaurants and retailers have been calling to ask how they can best apply the governor's directive to their stores, their individual stores, and then that they really want to understand how they can keep both themselves and their customers and their staff safe. So that has been excellent. Basically, what we are also, well, another thing that we're doing is that we are working with MEP to continue communication and cooperation with the business community. We very much appreciate that. It makes our job doable. So we're here and we are ready to continue to help the community find a safe avenue to reopening.
Well, thank you, Shannon. We're also joined today by a couple of beloved local business owners who can talk a little bit about their experience and what they're doing on the ground, both to keep open and to keep employees and customers safe. First, all the way from Betty's Divine on the Hip Strip, we're joined this afternoon by Amy McQuilkin, proprietor extraordinaire. Ms. McQuilkin.
Thanks, Mayor Engen. When we were first told we could open, to pivot back into that world was a little frightening. But then I remembered how close-knit and amazing this community is, and the combination of the health department and the city and just like business networks on our block, you know, people talking together. Suddenly I didn't feel like I was alone in coming up with a plan of safety. Going from buying and selling clothes to keeping people safe was kind of a hard transition to make. And now I feel really confident. The phase 1 retail business plan that I got from the Missoula County Health Department's website is clear. I've gotten a lot of great feedback on my plans, good feedback from my employee. I'm making it very visible and clear and transparent to my customers. And I feel really confident going forward that we're going to offer a safe environment. And like you said before, Mayor Engen and Grant here, we just would love some respect and patience from the community as we all stumble through this new way of shopping and being together.
Mayor, you're muted.
I am muted. Most people prefer that, actually. Thank you. Thanks, Amy. We appreciate that very much. Also visiting us from the hip strip this afternoon is Charlie Beaton, who it turns out sells ice cream once in a while at the Big Dipper, not only here in Missoula, but elsewhere. And Charlie, can you tell us a little bit about your experience and what it's like to purvey nature's perfect food in the age of a global pandemic?
Sure. It's been, can you guys all hear me okay?
We can, Charlie, thanks.
Okay. All right. Good afternoon. We haven't had to close necessarily. We have a walk-up business. We're pretty lucky in that way, but we did close for several weeks and kind of paused and came up with a plan where we opened as online ordering, which has worked really well, contactless. People can go online or on their phones and order. And then when the new phase came in, we were able to start serving again. So about a week ago, we were able to start actually last Friday, we were able to start scooping ice cream again. And what we've done is we've put these big blue squares out in our parking lot that go out to the sidewalk and down and around the block. And the squares are big so that they can be 6 feet apart. And that's really helped groups stay apart from each other. And we've followed all the rules that everybody, the health department and the state has put upon us. And I feel like we've done a really good job and have had a good response from people. Our employees feel more comfortable back at work now. We've also put in place a lot of things at work, like masks, and we're waiting on a thermometer. So we will do temperature checks on employees as they come to work, and hopefully they won't come to work sick either way, but we can double check that. So we feel pretty comfortable moving forward. And we also have a system in place so that if things do flare up, I feel like we can pull back a little bit and we could do the online ordering again. So we have some flexibility.
Mayor, you're muted again.
Sorry, I've gotten so good at doing that. My apologies. So before I open it up for questions, a couple of quick reminders. All the things that mattered before mattered today. So that social distancing, that hand washing, that taking care of yourself if you're symptomatic, getting tested, and the guidance around face masks. It's becoming far more common to see those face masks than not. And if a proprietor is asking you to don one of those, please be respectful of that and put it on. I have several, none of which are fashionable, but that's not unusual for me. So do all of those things that were important when this pandemic began. They remain important today. And with that, I'm happy to open up to press questions. We are in Microsoft Teams, and I don't know if I have a great way of managing that, so we'll just wait to hear from you all.
I'll jump in if that's okay. This is Maritza from NBC Montana, and my question is either for Charlie or Amy or both. I'm wondering, as you've reopened, what have been some of the biggest challenges, and are you seeing a good response from the community as far as numbers of people coming out?
I'll answer first, I guess. We've had a really good response. It's I was nervous reopening to see what things would look like, and the weather's been good too. But we've had about normal business over the last week, and I've noticed coming down the evenings that groups are finally really understanding where to stand in line. And but the challenges have just been getting, I guess, educating the public on how we're doing business, and also just making sure that our customers and our employees are comfortable.
And for me, I guess I'm not really officially open until Monday, the 11th, this coming Monday. This week we've been doing shopping by appointment. Our block has been really great for us to test our protocol and just kind of see how we communicate clearer. It's all about just that clear, effective, concise message. And I've been talking to other boutiques downtown and how we kind of want to all do it similarly so that there's not a lot of frustration, there's a lot of continuity. So far it's been good. And people have been patient and respectful. Really, I think the hardest thing to get people behind is the mask, which, being in the fashion industry, I am so excited that there's a new accessory on the market. I can't even tell you about it. So, I think it's been hard to get our delivery people to be wearing masks. I've been, making my employees wear masks, and now my customers, and now it's kind of transitioning to everybody, and just being patient and respectful to them. And, in our efforts to be inclusive to everyone in our community, I've added to our operating costs complimentary masks, as well as hand sanitizer, because I don't want to turn people away because they don't have a mask. I see it as more masks being out in the world.
This is David Erickson at the Missoula. Could I ask a question? I was hoping Shannon or Cindy could speak to the fact that, this is probably expected, as some businesses are allowed to open, but others aren't. There's some frustration from the ones that are not able to open. Like, I spoke with a fitness studio owner this morning who's, kind of looking at bars and restaurants being able to open. And, he's saying that his customers come by appointment only and would be 6 feet apart, and they're doing everything, sanitation wise that they see CDC guidance gives. So just wondering if you could speak to that.
I would like to say to that is that the fitness facilities are actually closed under the governor's directive. And so as local public health, we cannot open things up that the governor has closed. And so we do expect that we are going to see the governor moving forward probably later this week with opening up some more places that have been closed. And so that's kind of the answer that I have for that. Shannon, do you have anything that you would like to add?
Sure, I can do that. So I think with regulations, a lot of times it's hard to figure out where you draw lines. And knowing that it was time to reopen Montana, basically the governor made some decisions about which ones that should be opened first. And some of the ones that weren't opened were because they did present a higher risk. So for example, in a lot of gyms, there's a lot of shared equipment, and in classes, it can be hard to keep people apart. And I think that that's just what some of the decision making went into was, when you're deciding what places go first. And then over time, we know that that's going to change. And so it really has only been a week and a half since this started and since the reopening started. And I think that as we continue to see really good numbers, more places are going to be able to open. But at the same time, as a community, we're going to have to do this in a way where we don't have big numbers spike in our community. And so in some ways, it gives people time to come up with plans. And I know the goal is to get as many people open and operating as possible, but we have to do that in a way that makes sense and is safe for our communities.
Thank you.
This is Katie with KPAX. This is a question for Shannon or Grant. What specifically is being done to help businesses get the resources they need?
Maybe I'll, maybe I'll start, Shannon, if you want to add anything. So we're at a really unique position right now, because while we're facing reopening, the truth is for many businesses, they're still struggling with needs for financial relief and recovery funding. So what we've had to do in the last week is really expand the breadth of resources we can provide. So right now, we're working hard with our task force to make sure that we're understanding what's available through the new governor's grant programs. Those are going to become open to people to apply for small grants for businesses and individuals and nonprofits and others as early as tomorrow morning, I believe. we're trying to make sure that our business community understand what's available to them to fill in the gaps for the federal relief that's already come through. We're working hard to provide this sort of website that we have up right now that provides the guidance documents all in one place from the health department and all the resources. And then we're also starting to provide some additional support in the form of sort of WebExes and other things that allow people to understand even the bigger picture questions around, as a business, many businesses have never before had to, not only have they not had to worry about, it was sort of prohibited for them to ask questions about an employee's health. So really trying to give people access to information to take on these new challenges. And the last thing I'll say through our Economic Recovery Task Force is that trying to make sure that the information that we can glean and consolidate can go out through any channel, so that regardless of what group you trust or person you seek information from, just as Amy talked about, every business in our community is getting consistent information and starting to develop practices that can be familiar across the board, so that it doesn't matter if you're an employee or a customer or an owner. We're all talking about the same practices and implementing the same practices. So those are the things we're doing right now to make sure that we understand the needs of businesses and deploy the resources out to businesses as fast as we can.
And I think, Grant, another thing that I think that MEP and the task force and the working group are doing are compiling information about where businesses can get what they need to reopen. So things like thermometers or plexiglass. I think that was part of what that group is doing, is trying to figure out where those could be available to people. In terms of the health department and environmental health in particular, our role is information and helping people understand the regulations and helping people understand how it applies to them. And so we are working to be as available as possible. In fact, when the governor's directive first came out and things were really, we're going to reopen in a very quick timeline, we had people here on the weekend so that we could answer questions if people were calling, because they were getting information on Friday and potentially could reopen in some capacity as early as Monday. So we're just trying to be as available as we can within our staffing resources to answer those sort of questions.
Mayor, this is Martin Kidston with the Missoula Current. Can you hear me? Hello, everybody. Cindy, you had said that the health department. Okay, that's fine. Cindy, you had said that the health department can't allow businesses to open that weren't in the governor's order, but I believe his phase one order did allow some businesses to open that the local health department won't allow to open, such as salons and barbershops and so on and so forth. When do you expect to allow them to begin conducting business? And my second question is, how was the working group selected? And do you feel there's a political balance on the working group?
So I can answer your question about like salons and some of those places that were closed under the health officer's orders. While they were not included as not being able to open under the governor's directives, Ellen Leahy, our health officer, did want them to be closed a little bit longer, so that, because at the time we still had 9 active cases in Missoula and lots of close contacts. So it kind of goes back to what I was saying, that things have really changed in our community over the last week and a half. And I believe that towards the end of this week, she is going to be reassessing her health officer orders and looking at where we are now and making some changes to that. And I will let either Shannon or Grant talk about the working group.
Yeah, maybe what I would, in terms of original appointments to that group, I guess what I would say is, just to clarify, we have 2 different things. We have a task force, which is made up of our traditional community partners around economic development. And then we have a work group that was set up specifically to review and discuss protocols as they come out and field questions for the health department. That work group is what was sort of populated recently, about a week or 2 ago. In terms of my guidance and suggestions to the commissioner and the mayor in terms of who was on that, it was never, I personally didn't take any calculus around politics. My goal was to populate that with a group of people who I think could reflect the concerns of employees and customers and the insights of the business community so that we could get information and ideas to the table as fast as possible.
And I'll just add, Martin, that as a function of tipping up that working group, we had some requests from leaders in the community to expand that group and add folks. We certainly had folks representing labor and workers, but folks suggested we have more representation there, so we added some folks just last week to the group.
Thank you. And good job, everybody, by the way. Just want to get a chance to say that.
Thanks, Mark. Other
Cindy,
questions?
did you say end of this week that Ellen would reassess salons, or end of next week? I couldn't hear that.
Yeah, the end of this week, because then that will be one full incubation period of the virus since she wrote her health officer orders.
Thank you.
Other questions, folks?
I just have a follow-up.
Do any health officers here have any insight into when the governor may consider phase 2?
Well, to use Ellen's words, trying to predict the governor and what his actions are going to be is sort of like trying to read the tea leaves. We don't typically find out what he is going to do until he actually makes the public announcement, so I really have no answer for that.
Katie?
Yeah, I just want to ask what loans are still available for businesses?
So this is Grant. Maybe I could share a couple of things. So the original EIDL loans available through the SBA are still available, and I believe there is still a grant component available for $10,000. There are still about $140 billion available through the Paycheck Protection Program, and folks can reach out to their lenders or someone in the lending community right now to apply for those loans. They still exist, and there's a forgivable component of those. And what's new and coming online tomorrow are grants through the state, which will allow individual businesses, nonprofits, and others to apply for immediate relief. And depending on which program one applies to, there's a different cap for each of those different resources. So those are, in addition to those, I know that the Downtown Partnership has created a new grant program for small grants to businesses who are in need of support if they are working in the context of the downtown. And I guess I would just put in a pitch to Amy that if you're paying for masks, you should apply for a grant tomorrow through the state to help offset those costs.
I just want to throw out there, this is Josh, that the county has a COVID-19 relief fund, and we have $100,000 in there that recently been able to get a hold of that we are going to put out for give away in grants. In the near future, we're still in process on what that's going to look like. We just put this together, and we're also kind of holding our breath to see the details of the governor's plan tomorrow, and then we'll alter our plan so that our meager $100,000 complements but doesn't conflict or overlay with what the governor's doing.
This is Maritza again from NBC Montana, and I know we kind of touched on resources available to businesses, but I think Charlie mentioned he's waiting for a thermometer, and I'm wondering, you know, with some of those supplies, it's really hard to get things like thermometers right now. Is there any help that the city county health department can provide there?
So I can tell you, Maritza, we've had challenges as an emergency management agency, city county, in accessing those materials ourselves. So frankly, small businesses are probably better off trying to source those in other ways. We continue to emphasize the need locally for personal protective equipment, testing supplies, and anything sort of COVID related. But that is it's a slow process.
I would just add from MEP's perspective that the state is working with partners like us throughout the state right now to develop a sort of a pre-packaged kit that a business could order that would have a lot of the tools that they need. We're hoping that those are going to be available soon, and at least the way that this has been shaping up, we would expect a local company, Big Sky Fulfillment, to play a part in getting those shipped out to businesses across the state.
Other questions this afternoon?
Can I ask one last question for Grant, since he's on the line here? Grant, can you hear me?
Yep.
Recently, obviously the Northside Cattle House is closed, the Montana distillery is closed. There's been rumors of a couple other businesses that may close. Are there concerns that we may actually shed the number of jobs that the Bureau of Business Economic Development projected about 2 weeks ago? Or what's your crystal ball say at this point in time?
I will be the first to confess I do not have a crystal ball, but I would say that we are going to lose businesses in our community. And I think that what we've seen already is probably just the start of what we're going to see to come. And part of the reason for our asking for this press conference is that this is an incredibly hard time on individuals, and it's an incredibly hard time on businesses. We need people to cooperate and follow the guidance of our health department, to respect their opinions and their judgments when they tell us it's time to open, and to respect their opinions and judgments when they tell us it's time to not. And we have an incredibly hardworking business community, and we need our public to follow that guidance and to continue to do business with our local businesses in responsible ways, or we're going to see the kinds of community institutions like the Northside Kettle House Tap Room that we all love to see in our neighborhoods really struggle. And even if we do our best, they're still going to struggle. So I can't convey strongly enough how important it is that we all take this really seriously. This is not the end of the virus, but it's the start of a chance to be doing business again. And we really need people to think about how they spend their money, think about how they behave in public, and give our businesses the best shot by taking each step forward as wisely and effectively as possible.
Thank you.
And I can tell you for the record that if Amy starts getting big and tall men's apparel at Betty's Divine, I would be all about being divine. Other questions out there? Well, if not, you all have that email address for environmental health and Shannon's team. They remain a resource, as does everyone on this call. And we're all available at that COVID-19 website at Missoula County. Thank you all for your time today. Thank you folks participating as panelists and speakers. Thank you to the press and others for joining us. We appreciate your time today, and stay safe, stay healthy, and get out there.
Thank you.
Thanks, Mayor.
Thank you all.
Thank you.
Thanks, Amy.